We've got a full agenda tonight, quite on a lot, maybe more unusual than normal, quite a full agenda. But the first question, the things we want to sort of address today is what exactly is anxiety? Because everybody talks about anxiety. Everybody says, I'm anxious about that. But the reality is, what exactly is anxiety? And when does anxiety become problematic? Because you've come to find out that actually having some sort of pressure is not necessarily a bad thing. And we're going to come to that. When does anxiety or feeling under pressure, when does it become a bad thing? When does anxiety become a disorder? Because it's when it becomes a disorder that then one needs to seek help. Where is the dividing line? When do you know where you've crossed that line? What are the symptoms of anxiety disorders? What are the types of anxiety disorders that people experience? And how common are they? Also, what are the things that people can do? Because the interesting thing about anxiety is that is one of the commonest mental conditions. In fact, anxiety disorders are the commonest mental conditions we know of. However, what is also not so known is that anxiety disorders are one of the mental disorders that you can do a lot about, even without consulting with a professional. There are several things that people can do to help themselves, from diet to exercise, all sorts of things, which we are going to look into tonight. And of course, we're also going to look at meditation. People who have listened to me know that that's something that I'm always very clear about, and that I do say that because one is a person of faith, particularly that one is a believer in Christ, does not mean that one cannot meditate, because in fact, meditation in scriptures is something that is very well known. But interestingly, there is now mounting and in fact undeniable, irrefutable evidence that meditation is quite positive for mental health, mental well-being. That people who, and we are going to come to all the details of that in a short while. So we are going to look at that specifically because that's one of the things that I promised we were going to look at today. And then we are going to look at helping children and young adults, because the reality is that from where I sit, I hear it from parents all the time, parents who consult me or who've been told about the work that we do in Tripartite Care, and they get in touch. And I do know that it's something that is common in the community, and something that we need to be tackling and talking about. Then we'll talk about co-regulation. What does that mean? And if one has a child or a young adult that is suffering from anxiety, what can one do about it? And also, we are then going to look at, as we round up, we are going to look at resources, anxiety, particularly directed at self-help resources for anxiety, some of them that are generic, and some of them that are actually people who produce these resources, and they are very clear that not only are they producing resources from a scientific point of view, but that their faith, their Christian faith, also shapes the content that they produce. And the interesting thing is that I'm one of those people who believe that science and scriptures align. I believe that there's no contradiction. There's not a lot of, there are some contradictions, obviously, but I do believe that there are a lot of things that are working well in science that are actually founded in scriptures. Um, so, right. So what is anxiety? The reality is that feeling under pressure or feeling stressed is a common and normal human experience. In fact, being like that sometimes helps us to be able to perform optimally when we feel pushed, when we feel pressured. Sometimes it brings out the best in us. It helps us to then rise up to the occasion. And whilst anxiety is an unpleasant feeling of unease, tension, worry, or overwhelm or fear, um, it tends to occur when people are under pressure, when people are stressed. Maybe there's an exam coming, maybe there's financial pressure, or they are facing a problem, maybe there's challenges at work, maybe they're being bullied. All of those things can cause anxiety. And the way the symptoms that people feel, the experiences that one has in one's body is actually the way that the mind and the body is trying to rise up to the challenges that one is facing at that time. So it's your body gearing up to face the challenge and to rise up and be able to meet the challenges. And that's a normal thing. As long as it then doesn't become a permanent thing where it's almost like one is on high alert all the time. That's where the difference is. So it's feeling, for instance, for the last few days, I've been gearing up to the day. However, the fact that I've been gearing up, it's been on my mind, I've been preparing, did not prevent me from still being able to go about my normal activities, from being able to sleep at night, from being able to actually prepare for the events. I was able to put my thoughts together. I was able to put the slides together. Just like sometimes if I had an exam, being able to prepare for the exam, being able to study whilst one is an exam, is at the back of my mind. It might be, I'm a bit concerned. There is a concern that, oh, I've got to get this exam, I've got to pass it. There's a lot at stake. However, it doesn't mean that then I'm so preoccupied with the fear of failing the exam that I'm not able to study. And that's the difference between the type of pressure or feelings that help us to perform, or that help us to be optimal in performance, and the difference between anxiety that then becomes a disorder, anxiety that then becomes problematic. It's about whether it becomes crippling. It's about whether it's intense and it's present all the time. So, and this is, like I was saying earlier, that really there's a relationship between feeling under pressure and being able to perform. And this slide has been, I've been given permission by Dr. Erica Zubi, who is quite a leading person on LinkedIn. I think currently is one of the leading content producers, if not the leading content producer on mental health on LinkedIn. And it's very kindly granted me the permission to use one of the slides that he featured in one of his LinkedIn posts a while back. So I'm very grateful to Dr. Zubi for being able to do that. He runs a psychiatric practice in Montana, in the United States. So, and he's a very good psychiatric colleague. Right. So now in terms of, so as pressure mounts, performance also increases. As pressure mounts, performance increases. However, it gets to a peak point where no matter how much pressure you apply, what tends to happen is that performance then begins to decline. And the more pressure you apply, the less performance you get. So it means that the way to think about it is that performance peaks at some point when one is under pressure. And from that point on, if more pressure is applied rather than being kept at that peak, what happens is that there is a decline. And it's when that decline starts that we then begin to get into the zone of problematic anxiety. That's when the pressure is no longer of benefit. It becomes counterproductive. It becomes counter benefit. Really, it's contrary to benefit, and it's something to be aware of. That the fact that somebody is under pressure does not mean they have an anxiety disorder. In fact, sometimes that pressure can be, to an extent, it can be helpful to be able to perform optimally. And the other thing to note is that when one is under pressure, what happens is that there are two major systems in the body. There are two major systems in the nervous system. There's what is called the sympathetic and the parasympathetic nervous system. To break them down into simple terms, the sympathetic nervous system is the part of the nervous system that keys us up and helps us to gear up and prepares us to be able to fight back or to flee from any pressure to rise up to the occasion. However, the parasympathetic nervous system is the opposite. So whilst the sympathetic is called the fight or flight, which I'm sure most people know about or have heard about, the parasympathetic nervous system is called the repair and rest. So they're exactly opposite. So when anxiety becomes problematic, it means that the sympathetic nervous system, the fight and flight, is on overdrive. And the thing to do is to try and trigger the parasympathetic, which is for rest and repair. And the thing about it that a lot of people are not aware of is that we have a lot of activities that are within our powers and our abilities to trigger our parasympathetic nervous system at will. So it's possible for us. So when somebody's experiencing a panic attack, for instance, there are certain things that person can do to actually trigger the rest and repair system in their bodies. And after a few minutes, the body will begin to calm down because the body will get the message that you are safe. Because really, when everything is running amok in that way with the sympathetic nervous system, really what's happening is that the brain is sending a message to the body that it's not safe. Run, run, run. But what is possible and within our capacity as humans, that's a God-given ability, is that we can actually, by the actions that we perform, send a counter message to our brain to say, to our bodies to say, actually, you are safe. And that's something really very exciting, which we are going to get to. So we've said that anxiety becomes a disorder, or it becomes a condition to be concerned about when one is persistent. Usually, if you are facing an exam and you are anxious about it, after the exam, you're able to relax because the worst is over. You've done the exam and you are now waiting for results. But if one is still keyed up and is still on high alert, or maybe the intensity of the intensity of the situation is still such that it was like it was before the exam, then that might be that's a problem. And it's also about when the level of anxiety or the level of pressure that one feels in oneself and one's body and one's mind is far more than the challenge at hand, then that's also a problem. So really it becomes a disorder if it's persistent, because usually when it's a normal situation, when one is anxious, when one is under pressure and one under stress, as soon as the pressure, you come away from that situation, things get relieved. Your brain sends the message to the body that you are safe. However, if there's a persistence, not just persistence, if the intensity of the symptoms is overwhelming, that's another reason to know that it becomes a disorder. The other one is if it affects the day-to-day functioning, where one is not able to sleep, one is not able to eat, one is not able to do anything. It just takes over, the anxiety takes over completely. Then those are problematic, and they are that's when there's a need for help. And if it also makes life unenjoyable, and of course, if it also affects the lives of other people, because that's one of the other crippling things about anxiety as well, that sometimes it doesn't only affect the person who is affected, but also the people who are in their immediate social circles, people, maybe their family members, their colleagues, their spouses. Sometimes it's that intense. So that's when it becomes problematic. And so what are the symptoms that is associated with anxiety? And the way to look at it is it's literally from the head down to the tip of the toes. And I'll just go through that quickly. I think this word cloud just sort of represents it. It's got anxiety right in front, in the center of it, and it talks about worry. So basically, we've said it's an unpleasant feeling overwhelmed and fear. And it's usually when we are facing difficult situations. From the head, there's feeling of giddiness. There is not only giddiness, there are headaches. There can be muscular tension in the head. In the muscles can be tight. The person can have a dry mouth. In the throat, that can be tight. The chest, that can be tightness of the chest. One can feel one's pulse. One can feel one's heart palpitations. One can feel one's heart beating. The breathing can become very shallow. So that's going down. Now we've talked about the head. There can be blurring of the vision, like the person is just not seeing well. And all of these things sometimes make people feel that, something majorly is going to go wrong physically. They might begin to dread that they're going to have a heart attack or that they're going to have a stroke. The breathing becomes shallow, like I said. Also, the tummy becomes tight. It's almost like there's a knot in the tummy. Sometimes people experience diarrhea. Sometimes sometimes there's tingling sensations. There are tremors in the hands. All of these are symptoms that can be tingling of the fingers, the feet as well. As I said earlier, there can be tension, feelings of pain, also muscular pain, just a sense of tightness and uncomfortable feeling all through the body. And sometimes loss of appetite, insomnia. Also, there can actually be episodic overwhelming feelings of anxiety that is called panic attacks. And all of these are due to what I said earlier, the sympathetic nervous system going on overdrive. And as I said, triggering the opposite side, the parasympathetic nervous system, the calmer of the body, can actually make all these things calm down. So so anxiety affects the mind, and it affects the body, and it affects the emotions. I've spoken a bit about the way it affects the body. This is the way it affects the mind, feeling worried all the time, not being able to sleep, not being able to concentrate. Also, sometimes anxiety and depression are like identical twins. Sometimes even the best of psychiatrists need to be very careful in being able to say which one is the egg, which one is the chicken, which one came first, because sometimes I think sometimes up to 70% coexistence of anxiety and depression. So it's quite high. When there's anxiety, one is looking for depression. When there's depression, one is looking for anxiety. So I'm going to quickly show us a video. It's as good as, in terms of real information about mental health in the UK, I think one of the authorities is the Royal College of Psychiatrists. And the Royal College of Psychiatrists have produced a video on what mental health, what anxiety is like and what to expect. And I think that's a good summary of some of the things I've been saying. And that would be a good refresher for those or a good summary for those who may just be joining us as well.
We all feel anxious in difficult or threatening situations. It's a feeling of worry or fear that usually stops once the situation is over. Anxiety becomes a problem when the feelings are too strong or carry on long after you need them. With anxiety, you worry all the time and find it impossible to concentrate. You might feel tired and irritable and struggle to sleep. When anxiety goes on for a while, it's easy to feel depressed. Anxiety has many physical symptoms too. These include sweating, breathlessness, feeling sick, and an increased heart rate. It's easy to think these are signs of a physical illness, which can make anxiety even worse. Anxiety takes 3 main forms, and most people experience more than one of them. Generalized anxiety disorder is where you experience symptoms of anxiety most of the time. Panic attacks are sudden, unpredictable attacks of anxiety in situations you find difficult. They can also come on out of the blue. The feelings come on suddenly and reach a peak in about 10 minutes. A phobia is a fear of something that's not really dangerous. The nearer you get to that thing, the more anxious you feel, so you stay away. One example is agoraphobia, which is a fear of being in public spaces that might be difficult to leave. Luckily, there are steps you can take to overcome your anxiety. If your anxiety comes from a recent problem, it can help to talk with a good listener who you trust and respect. Self-help groups are a great place to talk and share different ways of coping with people who understand what you're going through. There are specific ways of relaxing to help control your anxiety. You can learn them through groups, from professionals, or from self-help books. You might be too worried to seek help for anxiety in case people think that you're mad. They won't. Anxiety is a common problem, and it's much better to get help than suffer in silence. Cognitive behavioural therapy can help you understand how your thinking habits can make anxiety worse or even cause it. You can practice CBT in groups or individually. You can even give yourself CBT through computer programs and self-help books. Medication can also play a part in the treatment of anxiety or phobias. Whatever you decide, remember anxiety is very common. Lots of people have overcome it, and so will you. To find out more about anxiety, visit the Royal College of Psychiatrists website.
I think that just sort of gives a very good summary. I think that's a very positive and clear message from the Royal College of Psychiatrists. What we are saying is that really a lot of people experience anxiety, and it's important to seek help, particularly when it's problematic in the way that we've described it earlier. But importantly, that a lot of people overcome the anxiety, and there are several things that can be done to overcome anxiety. And I hope that message comes out clearly tonight. And also as we progress, that the things that can be done become apparent in terms of seeking help. So I'm just going to go back to my PowerPoint slides. So the million-dollar question or the million-pound question is what causes anxiety? And that's something I hear whenever I'm talking about mental difficulties. People say, what's the cause? The reality is that usually with mental difficulties, there's no single cause of any mental condition. The easy way to look at it, this illustration was given, I think, by Dr. Daniel Amen, who is quite a leading psychiatrist in the United States, and is one of his resources is one of the ones that I've shared at the end, Dr. Daniel Amen. So you can put that in your list of, is somebody worth following on YouTube and his Instagram. He produces quite a lot of good content on mental health, and particularly from the Christian faith point of view. So the way he said it is this. He said, in order for you to have a gun explosion, in order for a gun to explode, you first need the gun, you need it to be loaded, and somebody needs to pull the trigger. So you need a gun, you need it loaded, and the trigger needs to be pulled. And he says that many times the predisposition to a mental condition is the gun. And what pulls this trigger? What pulls the trigger is actually stress. And that could be precipitating in several ways. So the way to look at it, let's see the predisposing, what we call the predisposing factors as the gun loaders. They are the things that load the gun. They are the things that make you more at risk. Prominently is genetics, the genes. We do know, for instance, that somebody is 5 times more likely to suffer from generalized anxiety if they've got a first-degree relative, maybe a dad or a mom or a brother or sister who has the same condition. They are 5 times more at risk. We do know that it also coexists in twins, that when you compare the rate at which anxiety disorders, for instance, coexist in identical twins relative to non-identical twins, there's strikingly more risk if one identical twin suffers from that condition, that another identical twin will suffer from that. However, when you compare it with non-identical twins, the risk is not as much. We also do know, for instance, that for some specific phobias, that for some specific phobias, that the risk, if one has a relative who is a mom or a dad, that the risk is higher in that person. But there are also other things like childhood experiences. If one grew up in a home where there was chaos, where there was parents didn't put any boundaries down, one is at more risk of developing an anxiety disorder as a child, as an adult, or even very earlier on. If one grew up with an anxious mom, apparently there is some link with the mother being anxious and the child then developing anxiety in the later life, or as they grow older. Trauma, loss, separation, divorce, or the parental divorce, anything that causes that child to feel unsafe in their early years can actually make them more predisposed. Children who are for instance, just anxious. For instance, when one as a child who doesn't like to go to school, is always crying, they have problems just adapting to change. That can be warning signs for the future. And there's also the brain biology in terms of, we do know that people who tend to have anxiety disorders tend to also have more intense and higher levels of stress hormones in their body, particularly cortisol. All of these things we can't do anything about our genes, but we can do anything in managing the other situations. We can do anything about the way we as parents model the way we deal with stress. We can do something about the way we manage the stresses that we confront, because we do know, for instance, when children have parents who are undergoing separation, divorce, all of those things can actually have impact. And the way those parents manage that situation, unfortunately, those are the realities of life, but the way they manage or do not manage them well can be a risk to their children in the future. Also, we've talked about learned behavior. Sometimes it's actually that if a child, for instance, is driving a bike and they fall off their bike, and their mom goes to them, embraces them and says, "Oh, I'm sorry, darling, you'll be fine. It's just happened. It's not. It doesn't mean that the next time you fall, you go on your bike, you are going to have a fall. Some of these things happen, but it doesn't mean that it's going to happen all the time." It's different from when that child is told off and when that child then begins to feel that risk is likely to happen again. Because over time, they might begin to imbibe that that's something that's going to happen, and they avoid that situation. And the more they avoid it, the more likely that they would then develop a phobia towards that situation. Also, it's important to realize that physical conditions, there are certain physical conditions, increased thyroid function, some hormonal problems, even things like, we now know that some women as well, when they get into menopause, might develop anxiety, might become anxious. We know that low glucose might also cause that. All of those are some heart conditions, even some cancers, because of the chemicals that are released into the body, can then cause anxiety disorder, symptoms of anxiety that mimic a mental condition. Meanwhile, it's really generated by physical problem. And so those are the things that can precipitate it. So we've looked at what can pull what's the gun. We've looked at what can pull the trigger, but it's also about what can keep pulling the trigger. Why do some people get anxious and they remain anxious? It could be because of chronic stress. Sometimes as well, when there's depression, that might also cause things to happen that way. So how common is anxiety? We do know that, as I said, it's one of the commonest mental conditions, if not the commonest. Anxiety disorders are the commonest mental conditions that people encounter. And they do say that about in a lifetime, that 1 in 3 people would experience anxiety disorders at some point in their lives. It's commonly associated with anxiety. We also do know that, for some reason, we know that it's commoner among females than males, and that on the overall, about 14% of the population at some point, at any point, would in 1 year, that's about more than 1 in 10, actually about 1.5 in 10 in 1.5 in 10 people will suffer from an anxiety disorder. And we do know that it can also be a very debilitating condition, because 2 out of 3 people who have generalized anxiety, for instance, also have another coexisting mental condition that affects them. So it's quite a debilitating thing. The other thing we do know is that 1,600 people in the UK, every week in England, 1,600 people are diagnosed with a generalized anxiety condition, and about 8 million people experience anxiety disorder at any point. So it's quite it can be, the impact is debilitating. Now, so in terms of anxiety disorders, how does one know what's happening? What are the types of classes of anxiety? Usually when somebody sees a psychiatrist or a psychologist, there are 3 or 4 questions that are usually on our mind. One, is the anxiety present most days, most times of most days? It's almost like it's always there. It's almost free-floating anxiety, almost always there. If that's the case, then it's probably generalized anxiety. If it's episodic, periods of remission and periods of coming and going, then it's either a panic disorder, or that if it's particularly that a situation brings it on, then it's usually a phobia. And phobia could be fear of traveling in open spaces, fear of leaving the safety of home, fear of traveling in trains, fear of sometimes fear of social situations, fear of even some people is for fear of heights, fear of flying. All of those they are called specific phobias. So the 3 questions will usually be: is the anxiety present all the time? If it's not present all the time, it means it's episodic. But if it's episodic, does it just come of its own, or is it sometimes associated with a particular situation, a particular condition? And sometimes as well, it's a mixture where it can be episodic, but there can also be free-floating anxiety all of the time. So that's the way that we use in making this diagnosis on the overall. But the other thing to also find out is that to also realize is that sometimes there's also what's called post-traumatic stress disorder, which we've spoken about before. For those who want to look at that, you can look at the Tripad Care YouTube channel. We've got something on trauma there. There's also obsessive compulsive disorder, which we've never really treated, but sometimes there's a school of thought that believes that all of those are anxiety problems as well. Because of the time, I will just keep that video. So let's just go on to, I said a lot, I said earlier that there's a lot that we can learn from, that there's a lot we can do to trigger our rest and repair system. And that when we do that, we actually send a message to our bodies that the body is safe. So the vagus nerve is the longest nerve in the body, and triggering that is what sends a message to the body that it's time to relax, that the anxiety or danger is over. And so, but there are certain things that can be done to trigger that. We do know that also that when we trigger the vagus nerve, that what happens is that the blood pressure goes down, the heart rate goes down, the breathing rate goes down, everything just returns to calm. It's almost like the message to the body is you can go to rest, everything is under control. So, and some of the activities that we're then going to be looking at now are the activities that actually help in triggering the vagus nerve. One of them is what's called the 7-8 breathing technique, 4-7-8 breathing technique. And it's basically about when we monitor our breathing in and breathing out in such a way that the length of breathing in is a lot shorter than the length of breathing out, then we are triggering the vagus nerve. And I'm going to show a video to that effect because I think it's just better to explain it that way. Where you usually, if it's in a clinic situation or in a therapy situation, one would tell the person to sit upright, put their back against the chair, the rest of the chair, put their hands, their palms facing their thighs, and be as relaxed as possible. For some people, they might want to close their eyes, and then we then tell them to take in a deep breath in a very slow way and count up to 4, taking in their deep breath, just counting up to 4, and then holding that breath for counting up to 7, and then exhaling through their mouth, counting up to 8. And that's really what it's about. So, and when one does that so that's one cycle. Breathing in for 4 seconds, holding it for 7 seconds, like one is not breathing in or out, and then letting it go for 8 seconds. And when one repeats that for 4 to 8 seconds, you can literally feel the anxiety calming down. And this is a skill that one can teach to people who suffer from anxiety, but also one can teach to children, one can teach to anybody can pick up that skill and use it to their advantage. So I'm going to
Fly with Abel and Phi.
I'm going to show
Sometimes the brain goes in overdrive when you are fearful and nervous. Say right before a big test, or maybe when you see a bully. At that time, your breathing becomes really shallow. The jumpy monkey in your brain becomes in control. It starts to pump oxygen really fast so as to make you run away from that situation. At that time, it's important for you to take deep breaths so that Mr. Smarty Pants in your brain can take control. That's when the 4-7-8 breathing is helpful. 4-7-8 breathing is a lot deeper, and we breathe from our diaphragm. Imagine there is a balloon under your lungs, and every time you breathe in, the balloon gets bigger and bigger. And then you prick the balloon and let the air get out slowly as you exhale. The way you do this exercise is to breathe in deep for 4 seconds, hold your breath for 7 seconds, and exhale for 8 seconds. When you do this, imagine the balloon inflating and then slowly deflating. Curl the tip of your tongue up to touch the hard ridge behind your upper front teeth. If you can't curl it up, just touch the hard ridge behind your front teeth. Now, let's do the exercise. Sit up straight. You may or may not close your eyes. Curl your tongue and bring it to the back of front teeth. Breathe in 2, 3, 4. Hold 2, 3, 4, 5, 6, 7. Breathe out 3, 4, 5, 6, 7, 8. Breathe in 2, 3, 4. Hold 2, 3, 4, 5, 6, 7. Breathe out 3, 4, 5, 6, 7, 8. Breathe in 2, 3, 4. Hold 2, 3, 4, 5, 6, 7. Breathe out 3, 4, 5, 6, 7, 8. Breathe in 2, 3, 4.
I believe that we sort of get the idea of what needs to be done. And the interesting thing is that that's something that I use in my clinic every day. Not every day, but very often. If somebody is anxious, that can be used to really calm them down. And the thing about it is that as one does that, one can actually begin to retrain one's nervous system in terms of really making the nervous system feel safe. There are many other things that one can do that I'm just going to quickly whisk through in terms of other things. So that's the breathing exercise. There's what is also called the grounding technique. The grounding technique is really using your 5 senses to calm yourself down. It's about looking around to see 5 things that you can see, 4 things that you can hear, 3 things that you can smell, 2 things that you can touch, and 1 thing that you can taste. So grounding technique, 5 things that I can see, 4 things that I can hear, 3 things that I can smell, 2 things that I can touch, and 1 thing that I can taste. And concentrating on that can also help in relieving anxiety. The other thing is progressive muscle relaxation. Just walking your muscle, clenching them and releasing them, clenching them and relaxing them from your toes, and walking your muscle groups up to your neck. Just doing them in groups that way, just flexing and relaxing, flexing and relaxing. But other even simple things like singing, humming, chanting, gargling, all of those, and there's no mystical thing about it, because I know that a lot of people wonder, oh, what's that about? But the reality is that the reason why that happens is because our vagus nerve passes through the area where the sensation from singing, where the sensation from gargling, where the sensation from chanting or humming takes place. So by doing that, what we are doing by humming, by singing, by chanting or gargling, is that we're actually stimulating the vagus nerve. And as soon as we stimulate that nerve, it sends a message to the body that the body is safe. And what happens is that the calming, and that even includes laughing in a hearty way. So when the Bible says that a merry heart doeth good like medicine, it's actually, science is confirming that. There are other things, be engaging with nature, particularly sights, sounds, smells, that also can be calming for people. Daily positive affirmation, scriptural meditation. I think very quickly, because I can see our time is well spent, I'm just going to go to the meditation part of things, because I know that one of the things I said we were going to talk about is how meditation actually impacts on anxiety. And there is now a lot of research showing that meditation, and when I talk about meditation, I've always said that the meditation that I practice is Joshua 1:8, where it talks about meditating on scriptures, and that meditation generally has been studied in neuroscience, in cognitive, in neuroscience, and generally mental health. And we do now know that there's a lot of research that shows that people who meditate are less stressed. It helps to deal with anxiety, and it helps to deal with depressed mood. And this is the way it works. Basically, what meditation does to our brain is that, one, it strengthens and thickens the front parts of our brain, which is responsible for managing our emotions, which is responsible for helping us to rationalize and to make decisions. So in that case, when one has overwhelming irrational anxiety, because meditation helps the part of our brain that is rational to think through, that's one of the positive effects of meditation. The other one is that it literally reduces the activity in a place in the brain that is called the amygdala. The amygdala is like the threat center. It's like the alarm of your kitchen alarm. It goes off whenever there's a threat. And when people meditate, we now know that the activity in the amygdala and the size of the amygdala actually reduces. The other thing we also do know is that in terms of memory, also the area of the memory, there's also what's called the hippocampus, which is the part of the brain that stores memory. That's also strengthened as a result of meditation. And importantly, the area of the brain which is responsible for ruminative thinking. You know, when you've been in a social situation and you start reliving the social situation, why did I say that? Or maybe they thought I was funny, and all those ruminative thoughts. It's the area responsible for that is the default mode network, and that area of the brain actually is turned off. It becomes more and more dampened, particularly in its ability to engage in ruminative thoughts that are detrimental when people meditate. So really, the scripture is true, and I've put some scriptural references there, particularly because I do know that there are people who are particularly interested in that, and I think that it's relevant. There's Isaiah 26:3. You keep in perfect peace whose mind is stayed on you because you trust in you. There is Psalms 46:10. Be still and know that I'm God. I'll be exalted in the health, and I'll be exalted. So there's also a 2 Timothy 1:7 that talks about God has not given us the spirit of fear, but that of boldness and of a sound mind. So really, And meditation in this case is really focusing our minds, putting our minds deliberately on those promises and on those thoughts. And really that's what meditation is about focusing our minds on particular thoughts. And that type of meditation where we think on scriptures is actually also known. It's quite known in neuroscience. It's quite known in science, in being of benefit. So that's basically how. And so for anyone who is struggling with anxiety, and this is not to say, I'm not saying that this should negate your need to ask for help. But I'm saying that if you're a believer as well, that we know without a shadow of doubt that meditation does help. Because what we are doing is we are rewiring the brain. We are teaching the brain to respond in a particular way, in a calm and measured way, rather than in a reactive way. We are teaching the brain to respond rather than react. So quickly, as we round up, how do we support children who suffer from anxiety? To start with, I think it's important to realize that most children, most mental difficulties that you see in adults, a lot of them started in childhood. 50% of mental conditions would have been developed by the age of 14. That's 1 out of 2 mental conditions that you see in adults would actually have started by their teenage years. And by the time you get to mid-20s, 75% of mental conditions have developed. So it means that really, as parents, and I think that's one of my pet messages, that as parents, when we are training children, when we are training our grandchildren, those people in our homes, we are actually shaping the future of their mental health. So it's really important to bear that in mind, and it's based on their education. It's based on the experiences that they encounter and the environment that we are creating for them. That's what's going to shape their future. So how do we help anxious children or young adults? One, we help them. That's anxious children or young adults who are suffering, who are encountering mental anxiety particularly. One is about helping them to identify the source or their triggers. Many times it could be something that is happening in the home. It could be because they are undergoing transition. It could be exams. It could, for the young adults, for instance, for the teenagers, it could be that they started using drugs or alcohol. All of those things can begin to manifest in anxiety. It could be that they are being bullied at school and they are not telling anyone about it. It could be that they are being bullied at work, they are not telling anyone about it. It could even be that there's molestation going on in the home, or maybe even in somewhere elsewhere in their social life. It could be peer pressure. All of these things. So it's about really, when a child becomes anxious, there is something, that child is telling us something. So that child is telling us something. It's also, so that's the first thing. What's the reason why this child is like this? What is the message that this child is passing across through their anxiety? And of course, the other thing is to be able to listen to them, to create emotional safety for them, because one thing that is marked with anxiety is I do not feel safe. That's the single message, that's the prominent message that anxiety is sending out. I do not feel safe. And so it's about knowing why they do not feel safe and creating that safety. Non-judgmental listening is one of them. Supporting them to confront their fears in a safe way is also another one. Helping them to get professional help quickly, and teaching them some of these self-soothing techniques. Quite a number that we've identified earlier today would be, but also managing our own emotions, because children learn from us. So that's why it's not a surprise that if somebody has an anxious parent, it's very easy for that child to then develop to grow up being anxious themselves, because that's the way they've seen their parents handle life, and that's the way they also feel that life should be handled. And it's also about being the source of hope for that child, and encouraging them to engage in self-help outlets, exercise, drama, sports, all of those things, because all of those things we also do know are helpful in helping to deal with anxiety. So I think the final slide, okay, co-regulation. So co-regulation is really about, I put this slide there because it's really about, as a parent, co-regulation is when you help another person when by the way you regulate your own nervous system, you can help them to also bring down, to send the same message to their own nervous system that they are safe. So it's by the way I respond, by the tone of my voice, by the calmness of my voice, by the relaxed posture that I bring into the home, into the situation, the empathy, the tone of voice, the gestures that makes that person realize that they are safe. But also sometimes it's also about talking them, literally talking them through the breathing exercises, literally doing with them the grounding exercises, literally doing those things with them. So not just that I'm teaching them to do it, I'm actually doing it with them. We do know, interestingly, there are certain cells in the brain that are called mirror cells. It means that different people, because people have a proximity to each other, that the similar cells in their brains are firing in a similar way, just by without any contact, just because they are next to each other. So it's almost like the cells in brain A is mirroring the cells in brain B. And these are things that have been proven, and there's no voodoo or mysticism about it. And we can use this to advantage, particularly as parents, as grandparents, to help children to deal with anxiety. So cognitive behavioral therapy, simply cognitive behavioral therapy, which is a commonly used form of therapy for anxiety, is about helping people to realize the toxic thinking patterns, to be able to challenge them and to be able to change them. And also to understand that our thinking patterns determine the responses in our bodies, and the responses in our bodies will then determine our emotions, and our emotions will determine our behavior. And it's a revolving cycle. So thoughts, that's why one of my favorite cliches is that there's no such thing as an innocuous thought. I was saying in church on Sunday that when you don't challenge a thought, you are passively giving it permission to continue. So by not challenging a thought, you are passively giving it permission. In fact, you are actively giving it permission to thrive when you don't challenge it. So basically, that CBT helps to want to identify those thoughts, because we don't get taught those things in school. But CBT helps to be able to make those links that our thinking actually then causes the different changes in our bodies, all the dry mouth, all the racing out, and all of those things, and then the way it then manifests into emotions and to behavior. And also, usually with treatment of anxiety disorders, it's usually the talking therapy that comes first. It's only when people feel that maybe talking therapy by itself is not effective that medication can be used. And it's also important to also bear in mind that sometimes, depending on the severity of the condition, sometimes antidepressants are used. Sometimes it's just medication to control the symptoms, maybe to control the racing heart, to control the palpitation, to control the tremors, just to make that person feel calmer in their body. And also sometimes there's a combination with both talking therapies and medication. But importantly, it's also important to remember that lifestyle changes. If, for instance, somebody is drinking and anxiety don't go together, certainly illicit drugs on their own accord are able to cause anxiety. And if there's a physical condition, then that needs to be addressed. One of the first things that we do when in a psychiatric clinic or in a mental clinic would be to do a blood test, to do physical tests, to make sure that what we are dealing with here is not even a physical condition, because so many physical conditions can actually also mimic mental conditions. So these are the resources that are available. The Every Mind Matters is it's like the government's website in terms of helping us to manage our moods and our mental generally. Lots of information on there, lots of short videos like I showed today on there. And for those who want to really, maybe if somebody is experiencing anxiety and they really feel that today is the day when they decide to tackle it, there are quite a number of apps out there as well. There's the Christian meditation app it's called Soul Time. I think it's by somebody from Bethel Church. It's an app, and it's particularly targeted at people of the Christian faith. There's a self-help website, livinglifetothefull.com, or llttf.com. There's also a YouTube channel, Wisdom Islands, where they talk about really focus on these mental conditions in terms of drawing from science and drawing from scriptures. There is the Feeling Good, the new mood therapy by Dr. David Burns. Neurocycle app, quite a lot of information out there, to be honest. There's also Dr. Daniel Amen that I spoke about earlier. There's also Caroline Leaf. There's somebody else who's just been doing videos recently, YouTube videos, I think within the last 2 or 3 years. Dr. Lee Warren is a neurosurgeon in the United States, and it talks about self-brain surgery, and it talks about really how you can actually, by your actions, perform brain surgery on yourself. Not literal brain surgery, but psychological brain surgery. He's got very brilliant content, scientifically grounded and scripturally sound. So quite lots of things out there. And of course, there's also it's also important, I think, where if one is seeking help and one wants professional help, the place to start is the GP, the general practitioner, and then from there the general practitioner can signpost to whatever needs to be done. And I'm just going to quickly whiz through this. So those are the things that Tripad Care provide, and we also do medical. We do training courses in a corporate way. And those are the things that are on the horizon for this year. And those are the future dates for Tripad Care, and also the future themes. I'm pleased that on the 28th of May 2026, the menopause and mental health talk that we've been talking about, we now have confirmation Dr. Awolaro is going to be able to do that on the 28th of May 2026. And that's quite exciting news. I know that quite a number of people have spoken to me about doing something on menopause, so I'm glad that there's somebody who is competent and who is able to deliver that in our team. And that's the Tripad Care Instagram page. So you can like us on Instagram so you don't miss anything. There's currently a number of features on there currently, featuring an interview I granted last week to Black girls in psychiatry. It tells the story about how I became a psychiatrist and why I enjoy my job, and really for those who are aspiring to be psychiatrists, what they need to do, and why I believe that psychiatry is the specialty of the future. So, and those are WhatsApp groups that we've got. That's a generic WhatsApp group. So if you just took a photo of that, it will take you on to the group, and then we can accept you onto the group. That's also this other group is for leaders, people who are leaders of charity, of churches, who are leaders in the marketplace, one way or the other, who have a leadership role or the other. And then, of course, we also do have a Tripad Care Blue Club that is led by Dr. Awolaro. Currently, the book being studied is The Body Keeps the Score by Bessel van der Kolk. And those are the contact details. Some of them you already know. The YouTube Tripad Care channel, that's my Facebook group, and LinkedIn is where I hang out the most these days, and also Instagram where we put up videos. And thank you for listening.